All right, this is part two of um, directional terms in anatomy, and it's part two because part one, my screen started to go dark, and I thought that the video would go dark, so I turned it off and started it again. I was talking about proximal and distal, and mentioning again that proximal and distal are always relative. So my wrist is distal to my elbow, but my wrist is proximal to the digits. And when we think about the digits, these are the digits right here, right? Our digits are made of three different bones, and we refer to this part of the digit as the proximal, and that part of the digit as the distal part. Okay? So proximal versus distal. One last set of anatomical directional terms that I want to talk about is dorsal versus ventral. And there are a couple of structures that we use dorsal and ventral for example, the foot. But the one that might seem a little bit odd is, for example, the spinal cord. So here's a transverse section of the spinal cord. Right, so the spinal cord is a tube that runs in the posterior abdominal and posterior thoracic wall up to, and in the back of the neck, up to the brain. And this side is the back side of the spinal cord, and it's the dorsal. And this side is the front side of the spinal cord, right? And it's the ventral. All right? If we were to use our standard anatomical terminology for a human, this would be posterior toward the back. This would be anterior toward the front. Okay? And you do see some people using anterior for this aspect, this side of the spinal cord, posterior for this side of the spinal cord. But most people trained in anatomy or neuroanatomy or neuroscience or neurophysiology use the dorsal ventral terminology. Okay? I'm going to draw a couple of other structures here. This is a set of nerves that come out, or branches of a nerve that come out of the spinal cord. They come together and then split again. And you see this also on the other side. So we have a right and a left one. Okay, but I'm just drawing this. And this structure here is called a dorsal root. And this structure here is called a ventral root. And there's an important structure on the dorsal root called a dorsal root ganglion. I don't want you to memorize dorsal root ganglion right now. What I'm just giving you is an example of dorsal in use. On occasion, you see somebody call that the posterior root ganglion. They call this structure the posterior root, or the posterior root ganglion. That is very uncommon. It's almost always called the dorsal root ganglion because they call it in neuroscience, neuroanatomy, this is the dorsal surface or the dorsal side of the spinal